Hey everyone, welcome back to another exciting episode here on Doctors Go Live with me, Nina Shahrukh Khan, your host. And today we are going to be talking about genetic testing, key to cancer prevention. Now, let us know who is tuning in, where you're tuning in from. How many of you guys are actually fasting? It's the start of the fasting month. Happy Ramadan. And do share with us how you've been, or better yet, what would you like to know in today's episode of Genetic Testing Key to Cancer Prevention? Hello, Norliana. Welcome. So, actually, did you guys know that genetic testing could be the key to cancer prevention? Now, let me know in the comments if you always knew this and what you would like to learn in today's episode. All right. Now, while you're sharing, also please be sure to share this video out because you never know who it's going to make a difference to. Also, you get to take part in today's quiz happening right at the end of the show after the Q&A, where you get to win a lunchbox. So, who wants to win a lunchbox? You definitely want to stay tuned for this episode. All right. Okay, so all this is happening right here in Doctors Go Live with me, Nina, and our special guest for today is Dr. Hema Darshinee Johnson from Columbia Asia Hospital, Bukit Rimau. Now, with cancer rates rising globally, there's never been a more critical need for early cancer detection and personalized treatment. Could genetic testing be the key to cancer prevention? That's what today's episode is about. We're going to be exploring the potential of genetic testing in revolutionizing cancer prevention, early detection, and treatment. Now, if you know someone who this information will be super useful, or if you think this is such an important topic to share with the world, and it's going to make a difference to somebody outside, please be sure to text someone you know, and you can share this video out on your social media. Be sure to tag your friends because you never know who it's going to make a difference to. All right. So welcome everyone. Hi, Soraya. All right. So before we continue, let's take a look at this video.
With cancer rates on the rise globally, the need for early detection and tailor-made treatment has never been more critical. And genetic testing could hold the key to preventing cancer altogether. I'm Dr. Hema Darshinee Johnson, Medical Officer from Columbia Asia Hospital, Bukit Rimau. Join me in the next episode of Doctors Go Live, where I'll be talking about cancer screening and how genetic testing can save your life. Happening on Wednesday, 13 March at 3 p.m. See you then.
Hello, welcome back. If you've just joined us on Doctors Go Live today we are talking about genetic testing, key to cancer prevention. And here to help answer all your questions, please welcome Dr. Hema Darshinee Johnson, Medical Officer from Columbia Asia Hospital, Bukit Rimau. Dr. Hema, welcome.
Hello. Hi, Nina.
Hi, thank you so much for joining us. Yeah?
Thank you too.
Okay, cool. So now before we begin, just a reminder to all our viewers at home that we have the Doctors Go Live quiz happening right at the end of the show after our chat with Dr. Hema. And we've got a couple of lunch boxes up for grabs. So be sure to listen to Dr. Hema closely in what she has to share because she's got all the answers to the questions, right? Okay. Now, of course, if you have any questions whatsoever during our chat with Dr. Hema, please be sure to ask to type it out in the comments, and we'll get to it at the end of the slides. All right. So, Doc, before we begin, can you share with us a little bit about yourself and what is it that you do at Columbia Asia Bukit Rimau?
Good evening, everyone. So it's my pleasure to be sharing this evening with all of you. I'm a medical officer from Oncology and Radiotherapy Department in Columbia Asia Bukit Rimau. I'm currently pursuing my training under oncology with Dr. Jendra and Dr. Kananathan, our in-house oncologists.
Wow. Okay. So oncology is, maybe you can share with us what exactly you do over there, and how you work with genetic testing.
So oncology, right? Our department, of course, deals with cancer patients, and how genetic testing come into play is that I have to admit we are not. This is not our expertise. Obviously, we redirect or rather refer our patient to genetic clinics. But again, this is something that has changed. It shifted the whole paradigm in cancer management altogether, which is what I'll be sharing with everyone today.
Okay, wow, that sounds really exciting. So why is it important that we talk about today's topic? I mean, what are you hoping the audience would take home after this episode?
Okay, like I mentioned earlier, so I would not be exaggerating if I say genetic testing has shifted the entire paradigm of cancer management, be it in cancer prevention, early detection, or even effectively treating cancer. So I'm certainly hoping to shed some light on cancer screening and how genetic testing could potentially contribute towards early cancer detection, if not prevention, the least. So
Wow. So,
hopefully this will open up the
okay. So
options to
if
others.
yeah, so if we are privy to this new information, it could actually revolutionize your health or save your life, right? Sounds good.
Yep.
Okay, so let's take a look quickly then. So, before we start, I think let's take a look at the cancer cases. We know that it's rising in Malaysia, but how bad is it exactly, Dr. Hema?
Right. Okay. So this is the latest reports published by WHO. In 2022 alone, there were an estimated 20 million new cancer cases being reported. This is not inclusive of cases that's not reported, who has not sought any medical treatment, and 9.7 million cancer-related deaths has occurred in that 1 year alone. So by the year 2050, over 35 million new cases, cancer cases are being predicted, and that is a 77 percentage increase from the current estimation of cancer cases in 2022. So as far as Malaysia is concerned, so according to National Cancer Registry, there's at least over 20,000 new cases being diagnosed each year in Malaysia alone. And contrary to the usual age population, so as how we used to believe, it's always been the average age group of cancer being diagnosed has been 40 and above. But in the last 2 years, we are seeing more cases being diagnosed between the late 20s to early 30s. And this number is predicted to double by the year 2027. So that's literally what we are looking at right now. And as I'm sure all of you have already heard of, 1 in 10 Malaysian has a lifetime risk of developing cancer by the age of 75. This is regardless of any other risk factor. So anyone at this point, as we speak, could potentially develop cancer at some point in their life. So yeah,
My God, so the number has really gone up. You said by
that's right.
70%?
We are
Okay.
predicting a 70% increment.
Wow, that's kind of crazy. Why is it just Malaysia or globally, or is the
Globally, this is a
number
global statistic.
okay? And is the rise in Malaysia steeper compared to other countries? Just wondering.
Okay, so this is as per their reports. Of course, there is slight difference in terms of developed countries and developing countries. So that does play a role in how the cancer cases rises. So it's contributed by both. One, it is truly increasing, but also that we are getting better at detecting cancers. That could be the reason why the numbers are also showing up. Yeah.
Okay, got it. And why do you think, from your experience or from your knowledge as a doc, why do you think it's rising? What's causing it?
Okay, so the rapidly growing global cancer burden, I think it does reflect both on population aging and growth, but it also is related to the changes to people's exposure to significant risk factors. And several of that is actually associated with socio-economical development.
Mm-hmm.
As we already know, as it has been established already, tobacco, alcohol, and obesity remain key factor behind the increasing incidence of cancer actually worldwide. Other than that, cancer-causing infections like HPV and hepatitis are rather quite relevant in countries with lower to middle income. So
I
that's
see.
what we are looking at right now. Yeah.
Okay, got it. Okay, so let's take a look at some screening methods. So we know that it's rising. How do we know if we have cancer, yeah, doc? And
Okay.
also, there's different types of cancer. So how do we know what to test for and what are the tests involved?
That's right. Just to keep things simple, I'll be quickly touching on common cancers, especially what's more relevant in our population. But again, cancer can present through various symptoms. It could be very organ specific. Symptoms like breast lump, nose bleeding, or a prolonged cough, even an abdominal distension. But on the other hand, it could also mimic completely non-specific symptoms like weight loss, unexplained loss of appetite. So they could equally be symptoms of cancer. But bear in mind though, quite often patient could be completely asymptomatic until its later stage. So that's what we are worried about.
Okay.
Yeah, which is why regular screening plays a crucial role in detecting cancers in earlier and more treatable stages. So therefore, that would altogether help us to bring down the cancer mortality.
Okay, got it. So this is where genetic testing comes in, right? I guess. So let's take a look at the slide, and maybe you can share with us what you know
Okay.
cancer
So
screening guide.
when all right. Okay. So again, cancer screening refers to any investigation that we perform when there's no symptoms, meaning we are targeting a population that's asymptomatic, right? It's completely different from diagnosing a cancer. But what cancer screening can help, we can detect them earlier, at early stage. Or we can take measures by identifying high risk groups and preventing cancers in them. Okay, so I will just quickly touch on breast since breast cancer remains the commonest cancer in Malaysia, regardless. In total number of cancers being reported for both men and women, breast remains the highest number
Highest.
in Malaysia. Okay,
Wow.
so
Mhm.
as per the latest WHO recommendation, women aged 40 and above is recommended to perform annual mammogram, regardless of your risk, right? This age may vary depending on the patient's risk factor. So certain groups of women are considered high risk, and some groups of men as well. Men, specifically those who have certain syndromes, like Klinefelter syndromes, those who are on hormone replacement treatment, and women with hormone replacement treatment, as well as those who's likely from a genetically predisposition family. Meaning, how do you identify those group? You may have one or more family members who has been diagnosed with breast or ovarian cancer before the age of 55. So as a general rule, the recommended age for screening, you start 10 years before the youngest family member who has been diagnosed with breast cancer. Let's say, for example, my mother is diagnosed at the age of 50, so my screening should start by 40. If she was diagnosed at 45, I should start at 35. The only difference is the modality might differ because mammogram may not be the best imaging for extreme ages like those who are aged below 25 or more than 60. So that time we might do things like MRI. So this is something you have to discuss with your doctor. But generally 40 and above, I will highly recommend everyone to get your mammogram yearly. But after a certain age, maybe 55 and above, then we can probably start doing every 2 years once. Okay, that's
Mm.
what's been recommended. Okay. And breast cancer screening has proven to reduce the mortality by up to 70% already.
Got
Yeah,
it.
so that's a good success rate already.
Okay,
Okay.
got it.
Okay.
Mhm.
Moving on, I would like to mention about cervical cancer. Cervical cancer remains one of the highest cancer rate even in Malaysia, despite our HPV vaccination, despite our screening programs. So the current recommendation is to start pap smear screening for everyone 20 years and above. So initially, what we used to recommend was we only offered this for those who claim to be sexually active. But the current guideline has shifted. So this is regardless of the sexual activity. They are already recommending pap smear 20 and above. This is what our National Cancer Society is recommending as well. And conventionally, we only do a pap smear testing, which means we just take and visualize the tissue. But now we have already incorporated specific HPV testing upfront because most cervical cancer has been associated with HPV infection. So that's about cervix. Cervix again has proven to reduce 80% mortality rate just by implementing cancer screening as well. So
Okay.
that's pretty much the most important one I would like to mention. I would quickly touch on colorectal cancer screening.
Mhm.
In a general rule, anyone aged between 45 to 75 years old, especially men, it's ideal to get yourself screened for colorectal cancer. This can vary from doing a simple blood test, it could be a stool test, or it could be via colonoscopy. But the guideline, like how frequently we do and what tests we do, it will differ according to your risk and the age group. So this is just a rough guideline on it. But for other cancers per se, like I said, since it's very non-specific, so a regular body checkup would be highly recommended.
Okay.
That's a general screening way. Yeah.
Okay, got it. So this is fantastic. So this is if you're healthy, there's no symptoms, but you just want to be safe, right? So you go for screening. Awesome. And this one, pula dok?
Yeah, actually, I think I've mentioned regarding the test. So
Ah,
this
okay.
basically mentions the test that's recommended according to your age group, according to your risk factor. Yeah.
Okay. And this one as well, I suppose.
Same. Yeah, that's right. Yeah.
Okay. So now let's go to the
Mhm.
Doc, one more thing before we go to genetic testing.
Right.
Oh, never mind. You said that if they're just go for a general health checkup, right? If there's no
That's
symptoms.
right.
Okay.
Mhm.
Sounds good. All right. So when it comes to genetic testing here, Doc, how does it come to play here? And is it only for cancer or we're talking about other diseases as well?
Okay. So genetic testing basically, in a nutshell, it looks for any changes in your genes, right? So based on that, it can give us information on genetic variants that could either be harmful, beneficial, neutral, or even unknown or uncertain effects, because there are many genes that we have identified and we are still studying. So that's the kind of information genetic testing could provide. It's not specifically to cancer, but of course we have started utilizing this to our advantage in terms of cancer diagnosis. But genetic testing is used for various other conditions. It's even used to test your predisposition for developing metabolic syndromes, diabetes, and all those things. But of course, in our context, I would be specifically mentioning regarding cancer risk. I just want to mention that we can't use genetic testing to diagnose cancer, but we can identify your risk. There is a thing called liquid biopsy, whereby we take your blood test and we may see circulating tumor cells in the blood. But then again, when you assess the patient, they probably will not have any manifestation of cancer at all. But again, that's not something that we could standardly use to diagnose. Like, say somebody comes to us and we've taken a liquid biopsy and it turns out to be positive, but we can't identify where's the cancer. The most often we won't be able to do anything. We are just going to monitor them closely. So that's the tricky bit when it comes to so-called diagnosing with genetic testing. Yeah.
Right. Okay. Got it. Okay.
Okay. All right.
Okay. So let's take a look at this slide.
Yeah, I know that looks like a very busy slide. It's just to illustrate the thing about genetic testing is, so when you request for a gene testing, right? I think many of us are already aware. You can either send through your blood. Nowadays, they're doing just by your saliva. A skin swab is just enough to get like a whole gene profiling done.
Mm-hmm.
And we can also do genetic testing directly onto the tumor tissues. So multi-gene panel will refer to various genes. That means we don't have a target that we are screening for. We just test for all possible genes that has been identified. And from there, we try to analyze what's your risk like. So that's when these multi-gene panels come into picture. But let's say we have identified a specific group. We are trying to look for certain risk. Let's say we found a family with a high risk of breast or ovarian cancer. Then we will definitely do gene panels that's very much related to your breast and ovarian cancers. So that's just to illustrate this. Yeah. Okay.
Right. Okay.
So,
Fantastic.
mhm. Okay.
Oh, so that's this slide, yeah?
Yes, correct.
Okay.
Okay, so this is like what I've mentioned earlier. So the limitation when it comes to gene testing, so whatever that's being tested, so you'll get like, I think the report comes up to almost 50 pages sometimes, really. So some genes, if you're tested positive, then we already know it's associated with a very well-known syndrome. So we will know what to do about it. We can offer you something, we can offer some preventive measures or even treatment for that case. But there may be genes that are not necessarily associated with any well-known syndromes, but we have well-researched. That is still, I think, somewhat a positive situation. But the not so helpful situation will be when we identify genes, especially the newer ones, we are still under study. We probably don't know the implication of it, and we don't have much to offer. So this is the limitation of the test. So when you're doing a genetic test, you might get any of these genes that's popping up. So it's a plus and minus situation, really.
Right. Okay. Got it. Okay.
Okay.
So this is about that. And what about this one, Doc?
Okay, so I'm sure when we mention about BRCA1, BRCA2, people often relate these to the Angelina Jolie syndrome, like how she was tested positive and she went on doing a prophylactic mastectomy and she removed the
Mm.
ovaries and everything. So that's the gene we're talking about. So when we're talking about this hereditary breast and ovarian cancer syndrome, meaning about 10% of cancers of these breast and ovarian cancers are contributed to hereditary factors. There are many genes that related in this particular group of patients, like BRCA1, BRCA2, ATM, we have TP50, those the list goes on. But why BRCA1, BRCA2 is significant? One, it's quite common in our population.
Mm-hmm.
Two, when someone has been diagnosed, when this mutation has been found in someone, it increases your risk of developing breast cancer up to 50%. 50% is a very significant risk, which means you will go on developing breast cancer or ovarian cancer. And there are other risks associated with it, which are slightly lower, like there are 15 to 45% chance of developing ovarian cancer, and you may develop a second primary breast cancer, meaning let's say I've already developed right-sided breast cancer and that tested as BRCA positive, I have a chance of developing a second primary, completely different to the type I had on my right breast cancer. So, and those with BRCA mutation tend to be the more aggressive kind. But the good thing about BRCA mutation is, let's say if I can screen, then I would know how to monitor them earlier with those with BRCA gene positive. So the screening would have started earlier, more frequently, and we'll be more vigorous in how we are detecting them. And now we have treatment that's targeting specific to BRCA mutated tumors. So that's how this is still relevant. And this is already done in Malaysia. So we do refer our patients to genetic clinics. There are labs that carry out. So we can either specifically request for this, or it comes in the whole gene panel itself. They will report it. Yeah.
Okay, that sounds wonderful. Right. Okay. And what about this one, yeah, doc?
Okay, so Lynch syndrome, okay, this is a kind of mutation in the DNA mismatch repair. That means it's a gene that works to repair anything that goes wrong with the DNA. You know, our DNA tends to replicate, right? So when the replication occurs, if there's an error, this is the gene that will identify and repair it. So when there is a mutation in that, so this unrepaired DNA goes on multiplying, and that's how you develop cancer. So those with Lynch syndrome, who have this mutation, they have a lifetime cancer risk of developing colorectal cancer. That's up to 40 to 80%. Endometrial cancer up to 60%, and other cancers like ovary and stomach. So they do have other risks like your skin related or small bowel related cancers as well. So in Lynch syndrome, how it's relevant to our population, we tend to suggest for screening for this in patients who have been diagnosed in early stage. Let's say by 30 years old, they're coming with colon cancer. Or when do your screening, we tend to find a condition called is familial adenomatous polyps. So they have a lot of polyps in their colon. So these are the groups that we will suspect who might have Lynch syndrome. So again, the same way how BRCA gene helps in early detection, this is something that will keep us on a high suspicion and a lookout for this group of patients. If anyone has a family member, I mean, if they're from a family with at least 3 members who's been diagnosed with any one of these cancers, it's also highly recommended to screen for Lynch syndrome already in Malaysian setting.
Wow. Okay.
Okay? Yeah.
So once we detect all these early, yeah, doc, there are recommendations on what's next to do, lah.
All right. So the steps in genetic testing is, of course, if you're coming to us without symptoms, just for screening purposes, you will be referred to a genetic testing. Upon receiving the results, there's a process called genetic counseling. So we will provide counseling. It's done by the genetic team itself and relevant team, including the oncologists and surgeons. So that way, we can advise you on what to do next. Because not everyone is going to be advised to undergo mastectomy or to remove your ovaries. It literally goes by your risk. And we will advise you what's best. And of course, that will help you to make some form of informed decision. At the end of the day, the decision comes from the patient again.
Yeah. I see. Okay. Got it. Which comes to the next slide, doc, which is basically the end. So at the end of the day, doc, what do you want people to take home?
Okay, so of course, as I mentioned earlier, there's ups and downs with this genetic testing. The good news is the advancement has provided us some insight on what we can do, how we can detect the cancers early, and how we can provide treatment targeted to certain tumor profiling. But the only concern now is certain group may directly benefit from this genetic testing. But for some of them, it could purely be just providing some kind of emotional or mental reassurance. In contrary, what can be a downfall to this is it may incur unnecessary anxiety and stress in general population. And of course, the cost impact. These tests are not cheap. And but again, once you've done a test, you must be able to afford the treatment as well. So this whole, it's like a vicious cycle. So it
Right.
always, yeah. So if someone can do the testing and they could afford the treatment, then it's a win-win situation. For those who probably could afford the testing and may not be able to have an access to the treatment, that could be a very disappointing situation. So that's the downfall to the testing, I would think. And the access to the testing is still very much limited. Not everyone have an easy access to the testing. Some places are still outsourcing for certain specific gene testing. So that's there. But as far as cancer treatment is concerned, I'm all for genetic testing because this tumor profiling has shifted uh, the entire paradigm in cancer management. Because now we can tailor the treatment. So we are not just testing the tumor to see what treatment works for them. We can assess what will work for the patient. Like for instance, let's say someone comes with a breast cancer. We test the tumor if it's a HER2 positive. It's a kind of mutation, right? So we know we have a treatment called Herceptin that can provide good tumor control. So that's a good thing. Or we can screen for patients, say there is DYPD deficiencies. These patients tend to not be able to tolerate certain kind of chemotherapy. So in those patients, we will at least give an alternative. Some chemotherapy can be even fatal to certain gene profiles. So this is how it's a plus. So but it depends on the situation, really. So we have to discuss. But what I would like to put out there is, it's good to come out and discuss with your care providers. So at least you'll be able to make an informed decision. That's the most important point here, really.
Okay, got it. Before we continue to the next question, if you have any questions whatsoever, please let us know in the comments. All right, with respect to Dr. Hema or on genetic testing or on anything. Yeah. Right. So now that we know all this, yet, Doc, at the end of the day, in your experience, what are the common mistakes that most people make when it comes to this topic?
I think generally when it comes to cancer, there's a lot of stigma related to it. One thing, there's a lot of fear associated with cancer.
Mhm.
Not many people are willing to have this discussion. In fact, some find this to be, they don't even like talking about it because it seems to be attracting some kind of bad energy, bad vibes. That's what people tend to believe in. The thing is, cancer is more common than we think it is, and there are
Okay.
various options of detection and treatment. So I guess together we would be able to win this battle only if we can create the necessary awareness.
Okay. Why do you say that cancer is more common than we think it is? Maybe you can share something that a lot of people are not aware of.
I mean, 1 in 10 is it's a very significant number for Malaysians.
Hmm.
That means that could be any one of us. Even right now, as we speak, one of us could go on developing cancer. So that's how common it is. It is not something that's a rare occurrence like those days where we see probably like aunt of an aunt who would have developed breast cancer. But now we probably know at least one person in our circle who has developed some kind of cancer. So it is becoming more relevant to our lifestyle. So it's important for us to be able to have an open conversation about this because the longer we have this fear around cancer, it not only makes you not want to come forward to learn more about it, it's worse for those who have been diagnosed with cancer or who even have symptoms. We have so many patients who probably comes to you like, it'll be a huge breast lump. That's something that you can hardly miss. But they can come to you like after, you can guess maybe it's like what, for years? So it takes very long for people to come forward and just accept it, to deal with it. It's not easy, no doubt. But I
Hmm.
think if collectively as a society, we have an open mind approach towards this, that will help the society be a bit more motivated and positive in approaching cancer, I would think.
So I guess what you're addressing here is the society and the willingness to talk about it, because then healing
Fair.
can come in, right? Yeah. But if we're not willing to talk about it, it's hush hush and stuff like that. It's scary,
Mm,
it's taboo. Then we're making it worse for healing to start and acceptance
that's
at
it.
the end of the day, right? Okay. So
Yeah.
last but not least, do you have any advice for people out there when it comes to cancer or genetic testing, for people who already have it or have loved ones? What advice would you give them, and what should they expect, especially those
Mm,
considering genetic testing?
I would strongly urge everyone to come forward and have a conversation. It's not a must to do genetic testing, but it'll be good start to have a discussion about it and weigh out your option. It may be a better option for certain people, and if you can, I would strongly recommend you to do it. In fact, some screening are done in even KKM setting, meaning government hospitals are referring you already. So that's how significant this has become. So that's for those
Right.
who are considering screening, and to not take your body for granted. Because as difficult as it sounds to get through this whole screening process, right? It sounds very it sounds like too much to do, to go and see a doctor and get yourself screening, wait for your mammogram and everything else that's associated with it, right? With the blood test and scan and the fear. But I can assure you, having seen my cancer patients go through this, I think that's a harder process. Once the diagnosis has taken place, it's you would wish you have done all this earlier. That's first. And
Okay.
if, or for those who have been diagnosed, or those who have a family member with cancer, of course, I would not be able to tell you I understand. But again, I can empathize with your situation. I think it's not just a disease that one can just be diagnosed and get a treatment and get over with it. It affects everyone around you, your family, your neighbors, everyone. It changes the world upside down for that particular patient. But again, I think it's good to be open about it, talk about it. There are a lot of supports available outside, and we are in a very good time. I think compared to 10 years ago, where we had many cancers, which means cancer means could potentially be a death sentence. But right now, we are
Oh,
good to say that, not necessarily. We are seeing
yes.
many patients who are coming out of it, who's being cured. The cancer survival rate in Malaysia is actually going up, which is a good thing. So we are
Okay.
moving towards a better future, surely.
Okay, fantastic. So, cancer is not what it used to be. People don't die from it anymore. There's more people surviving it. Okay, so and
That's
there's
right.
more treatment, and there's more early detection options for all of us. And genetic testing is one of them. So be open and keep a lookout on it, because you never know who or which family member it's going to save. Because 1 in 10 will eventually get it. Right? It's more common than we think. All right. So there's a question here, and I think this is what's next. How can individuals access genetic testing for cancer? Because you said it's not easily accessible. And what factors should they consider before undergoing such testing?
Okay, so as far as Columbia Bukit Rimau is concerned, we do
Mhm.
have specific screening packages. I think that's shown on the screen. These are basic screening packages, but we do offer genetic testing. But you may want to discuss with us first. You can always come for a consultation with our oncologist. They are
Mhm.
more than willing to discuss with you and recommend what's best. And hopefully, you'll get a better prorated price when you go through us. We do outsource some of the testing,
Uh-huh.
and we have done basic gene profiling for many of our patients. Liquid biopsy is still very much relevant and something that we have been practicing here already. So yeah, come to us and talk to us. We will be able to offer what's best for you, really.
Okay. And I think somebody wanted to know what is the package price or what package is offered. Could we have the slides again?
Mm-mm.
Okay. Yeah. Could you share with us what you guys offer?
Okay, so there is a HPV and DNA testing. I think that's about 260. This is for cervical cancer actually, and the
Mhm.
Pap smear package. So that's about 120. But in terms of mammogram, they're offering it for 250. Some month, like for the October, pink October, usually there's a discount price for mammogram usually. And there is a full package where they'll include your tumor markers, your pap smear, all that is done together. This is for women cancer screening package, where they do your cervical screening as well as breast cancer screening. That's for about 800. But I guess this price, sometimes they do give certain discounts. So you can always call Columbia Asia and get your price at that point. As far as male cancer screening, of course, it includes other cancers more relevant to male, like prostate, colon. So that's about
Mhm.
430 there. So this is the package that's being available. It does not mean we don't screen for other cancers. Like I think one thing I've not mentioned on my slide anywhere is nasopharyngeal carcinoma. That's still very much a common cancer among our population. That's a cancer that Lee Chong Wei had. So it's
Oh,
it's,
okay.
it's a tumor that goes behind the nose actually. It's a nasopharynx. So that's quite common in our population. So Some of the symptoms can be just as simple as nasal congestion or nosebleed or just difficulty in swallowing. So these things can equally be screened. So you can always come to us and talk to us about it. Yeah.
Okay,
As far
got it.
as genetic screening, we have few vendors that's been offering genetic testing. So you get to choose which one works for you. So the price differs according to what are the gene panel that's being included and which vendor you're opting for. Yeah.
Okay, so this Natalie, I hope that answers your question. Kelly Wong has a question. Her question is this package available in Columbia, PJ? That one, I think.
No, it's the one that I've projected. Of course, what's available in Bukit Rimau. I'm not too sure about Columbia PJ. Literally, I wouldn't be
Okay.
able to answer on that. Yeah.
All right. So if somebody on the team can help answer, I will verbally say it. But in the meantime, we'll get back to you. Okay, Kelly. Okay, next question
But
is
again,
from.
sorry, Nina.
Sorry.
Yeah, for cancer treatment, I mean, Bukit Rimau is the only oncology center for Colombia. So basically, when it's cancer related, I would highly recommend to come to us because we have an
Yes.
in-house oncologist team here, right? Yeah. Okay.
Yes, yeah. So Bukit Rimau is Columbia Asia's oncology center. So anything related to
That's
cancer,
right.
the most advanced one, everything is in Bukit Rimau. So if you're really looking for cancer related stuff, you definitely want to go there or pick up the phone and just give them a call. Yeah, we'll
That's
try and find out what other screening packages we have in PJ. All right, next question comes from Sakina. Can we do genetic testing at your hospital in Bukit Rimau? I think you
Yeah,
just
you
answered
can
that.
come. Yes, that's
Yeah.
right. Of course, we don't do it in our lab, but we outsource it. But it can be arranged through our hospital.
Right.
We work closely with certain vendors, so you can come and talk to us about it.
Okay. So definitely it's your one-stop center lah. Yeah. Kind of thing. Okay. Cool. Next question is from Suraya Aziza. Is there any criteria I need to meet to have genetic testing?
Not necessarily. Of course, genetic testing, any one of us can do genetic testing, but there are certain groups that we highly recommend you to do it. Like I mentioned earlier, for breast cancer, the specific high risk group, those patients I would strongly recommend, but anyone can go for genetic testing, really. Yeah.
Okay. Which goes to the next question from Jessica Lee. Is it open to all ages? Is genetic testing? That's a very good one.
So of course, this is not my expertise, but I assume anyone. It's not age specific, but again, if you're talking about cancer screening, probably depending on the cancer we are trying to look out for. Of course, for breast cancer, maybe you can screen as early as even 17 years old. But if you're looking at other cancers, maybe depending on the age group, yeah. But it's in general, if you're talking about just doing a gene testing, what they're doing nowadays, like your ctDNA and all those things, anyone basically can go for it. No age limit. Yeah.
Okay. Yeah. Children get cancer too. So it would be
But
good
bear
to
in
do.
mind, though, the thing is, these mutations, right, they're dynamic. So it does not mean, let's say I do my genetic testing at 17 years old, it does not mean nothing will change by the time I'm 50 or 60. These things rapidly changes as well. Yeah.
I think that's one of the questions we have. Yeah. So,
Okay.
which is not related to that, but let's see.
Oh.
Jessie Lee's question is: so, if the cancer genes are detected early, does it mean it will develop into cancer? Maybe you can shed some light on that. If what can be done.
Okay. So basically, okay, it's not a must. It depends on what, like I told you, like BRCA gene, right, for that matter.
Mhm.
If BRCA gene mutation, we know there's a 50% risk, which means it's a very high risk. At some point, they probably will go on developing a cancer. This may not be the case for any other gene, but how this helps is once we know a person has certain mutation, we know this is the patient with higher risk as opposed to a person who does not have this mutation. So we might screen more closely. So the aim is to catch the disease earlier. Certain things we can offer some measures, the same way how we do prophylactic mastectomy and prophylactic surgery to remove ovaries. So this is depending on what is the gene that we are detecting on, really. Yeah.
Okay. Definitely right. But basically, the
It
earlier.
doesn't mean it will definitely develop into cancer. It's not.
Right. And actually, that's the whole point of doing the gene testing so that we can
Correct.
prevent and early detection so that we can intervene fast, right?
Mhm.
Okay. And what is the accuracy of the test results? Jessica's
Accuracy
question.
meaning the gene testing.
Yes.
Okay. Whether if you have found certain mutation is going to be true or not. So the limitation with the test is depending on the tissue biopsies. Let's say I'm taking certain tissue or a saliva sample. Sometimes it may not be sufficient. But say they have a sufficient sample and they went on producing the result, the any test that's been in the market, any vendors, it will not be allowed unless there's an accuracy of more than 90%. So it's an accurate result. You can go by that. In fact, as some of the reports I do see, they do report what are the chances. So it comes
Mhm.
very comprehensively. It's very much reliable. Yeah.
Okay, got it. Suraya has a question. Suraya's question is genetic testing a one-time thing? I think you sort of answered it, but it'll be great if you could answer Suraya again. Great question, by the way.
So depending on what setting we're talking about. If you're talking about assessing your risk, that's probably sufficient to just do it one time, one-off thingy. So you know your risk, you know what to do next. But if you're talking in terms of personalized medicine, you know how we test for the tumor or the patient's tolerance, these things will change over time. So say person A has been diagnosed with certain tumor and it's been an aggressive tumor and it recurs in future, the tumor profiling might change over time, you know. So if it's long enough, then we tend to repeat this testing on the tumor. We can even repeat the testing on the patient affected itself, because how the amount of treatment the patient might have received will also alter their genetics. So this thing is dynamic when it comes to treatment itself. So you might come
Okay.
across anyone in your family, probably the doctors asking you to do a testing again on the tumor test, which you probably would have paid and done a few years back. So that's the reason why we do it. It tend to change, yeah.
Right. So if it tends to change, how often do you advise people to it? I mean, I'm just wondering.
There's no, it's a very subjective time frame, really. So let's say if you're talking about breast cancer, if I've been treating someone for breast cancer and this patient is already going into like fourth or fifth line of treatment and it's no longer responding to certain treatment, then it's a clue that maybe the genetic has changed. Maybe we need a different approach. So it's a very clinical based judgment, really. There's no
I see.
specific time frame. Yeah.
Okay. So basically, I think the answer is consult your doctor, kind of thing. Also, we got the team has actually replied. So the package is only available at Columbia Asia Bukit Rimau because that's the oncology center. So if you'd like to take advantage of that, go for a drive. All right, it's not that far. You guys are like 45 minutes away, right?
Yeah, less than that probably if there's no jam.
Yeah, let's do that. So go for a quick drive, see Dr. Hema in person, and meet. It's close to Tanjung Malim, right? You can have the Tanjung Malim Pow, make it an outing, kind of thing, right? Okay, Yiki's question is any preparation I need to do before my genetic testing? I think you answered this. The answer is no, right?
Not that I'm aware of. Usually, we'll just get the patient to come over and we do it. But depending on the sample, not so much for the serum. But I guess if you're taking saliva testing, they will advise you to not bring certain things or something like that. But I wouldn't be able to advise on that. Usually, we go by the vendor. Whatever they advise, we go by that. Yeah.
Okay,
But nothing
so just
specific per se. Yeah.
okay. So how many types of genetic testing are there? Is there like a few? And what
Like
samples
I
do you
told
take?
you, I mean, in a broad spectrum, if you're doing like a general gene profiling, that's what whatever you see on the net generally refers to that. I think what's in right now is your ctDNA and your genobites. These are people that's providing you to just read your entire gene profiling, and they tend to tell you what are your risk of developing diabetes or certain cancers. So that is general. Something that you test for certain mutation, then of course we are saying we will request specifically to test for BRCA mutation. So they will only look for that. They're not going to report anything else. So that's there. And the third one would obviously be in terms of tumor profiling. So this will be testing based on the tumor itself. So that is something we test for. And this is obviously in a setting of where you've already been diagnosed with cancer. And we test for certain patient factor. Like I told you, some patient can tolerate morphine, some patient cannot. So those things are related to certain gene. It's called, now we are doing this epigenetics, pharmacogenomics. So we are trying to incorporate genetics into pharmaco, which is your drugs, and we are trying to
Mm-hmm.
incorporate it into your tumor. So it's an expanding field, really.
Mm-hmm.
And it's rather empowering the patient at the end of the day. So at least you don't feel
Okay.
stuck. You know you have an option. Yeah.
Okay, got it. So we've got another question from Sakina. My family has cancer genes. Should we all go for gene testing regardless of age, 20 or 30s, or only those of us in high risk age group? I think this is a fantastic question.
Mm, so, like I told you, right, it would be depending on what kind of genes we're talking about. Of course, if you're talking about those who have breast and ovarian, if you're talking about those genes, then we would recommend the general screening, like I told you, starts 10 years before the age of the youngest member who's been diagnosed with, right? So that's there. So obviously, we will ask the women in the family to get screened for those genes. If you're talking about Lynch syndrome, it's rather more common. Not to say it doesn't affect the others, but it's quite common among the male population. So it goes by that. This is the two common ones. But other genes, if you have the means, by all means, yes. But maybe it's not necessarily as early as 20. But 30s, yes, we might have to consider it. So like I can't put a number on it for you. It goes by your risk and your family's risk. So we have to, it's a very subjective term. Yeah.
Okay, got it. I think this question has come up again. Just to quickly answer it, if I get the genetic testing now, do I need to get tested in the future? Also from Natalie, how frequent do we need to repeat the tests?
Not if you're screening. If you're screening, if you're just doing it for your to get your gene profiling, you don't necessarily have to repeat it. What we're talking about repeating is in the sense that those who have been diagnosed, who are doing tumor profiling, those are the ones who we know we must repeat. Not in the sense, let's say if I walk in to just get my gene profiling done, I may not be repeating anytime soon at all, or never for that matter. Yeah.
Mm, okay, and this is somewhat related as well to Ainun's question: can genetic testing results change over time?
Not the risk factor, not the gene that's been inherited, that won't change. What will
Mm,
change if we have developed certain condition, that genetic of the condition itself might change. Like the tumor might change. It might behave differently over time. Within like say a breast cancer, right? Since everybody's asking for a year, usually if it comes back in 5 years, we will always repeat everything because we know
mm.
that would have changed in 5 years. Yeah.
Okay, got it. Okay, so okay. Jesse's question is genetic screening only for cancer? Can it be done for other conditions, disease?
It can be done for many other conditions, actually, medical related questions, autoimmune conditions. They even do it, they are even, from what I've seen, of course, this is not my expertise. I have to mention that again. But again, what they do report, they even say your tendency to be allergic to certain things. That is even reported in testing nowadays, actually. So,
Mhm.
yeah, it can be done for other various conditions.
Okay, got it. I think let's take a break from the Q&A. If you still have questions, don't worry. Please let us know in the comment section. We'll answer them. But for now, let's take a break and let's go to our quiz because, as mentioned in the earlier part of the show, there are lunch boxes up for grabs. So who wants to win? This is your time. All right. So what do you need to do to win? First of all, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everyone can see it. Next, answer the 3 questions that we're going to be showing on screen in a single comment, in a single line, and you're on your way to win the prizes. So let me repeat. First, share this video out 3 times and remember to set the post to public so that everyone can see it. And secondly, answer the 3 questions we will show on the screen in a single comment, and we will select the first 3 winners based on the correct answers and shared posts. So are you ready? All right. So here are the questions. Question 1. Cancer cases are slowing down in Malaysia. True or false? Cancer cases are slowing down in Malaysia. True or false? Question number 2. Genetic testing can help cure a patient of cancer. True or false? Genetic testing can help cure a patient of cancer. True or false? Question number 3. A PEP test helps in screening for cervical cancer. True or false? A PEP test helps in screening for cervical cancer. True or false? Remember to answer your questions in a single comment and share your post to public. All right. So while waiting to hear who our winners are, we're going to go back into the Q&A. Okay. So the next Q&A is from Natalie. Natalie is asking if your vendor's strong record over how many years? Over the years. This one
I
you
mean,
have to answer Doc, because I don't know that.
Um, okay, so I don't know about the years bit, but these are validated, tested. So how we recommend, of course, many vendors come to us. We recommend as per the accuracy of reporting and the extensive, how detailed the reporting is. That's one, and we go by, of course, the feasibility in performing. Because some of it is a bit complicated. We might have to dispatch and outsource to overseas and all those things. Some make it quite easy for us to reach them. They even come to us and collect the sample. So that's how we go by recommending. If I can mention, I think right now we mainly go for Genobite because that has been, we've been having a good record with their reporting so far. So yeah, and patients have been quite happy with it as well.
Right. Okay. So, Doc, I have a question. You know, there's all this genetic testing online, something DNA, kind of thing. And they also can do like what you're at risk for. Is it the same sort of test that you guys do, or is it different? And how accurate are those tests? Because, like, I would like to know where my genes come from, but I don't know
Oh,
if
this
that's
is the
accurate.
one that's online, right? You're talking about like where they
Yes.
say, of course, that is not. Uh, I've not done one myself.
It's a
Uh,
saliva, I think. Yeah.
Correct. It's a saliva.
Yeah.
That's a ctDNA test. So
Uh-huh.
that's a very general reading, and they tend to give you your risk for certain things. I've seen in one of my patients where they talk about that patient could be allergic to certain kind of food. They even mention what chemo they might tolerate and those kind of things. So it's a very general thing. Of course, that's not what we do here. What we do is something like I showed you earlier, the multi-gene panel, right? So we have
Mhm.
genes that's been associated with cancer development. So we specifically look out for those actually. So if you come through us, obviously we're not going to get a gene profiling that's going to tell you your risk of metabolic syndrome per se or your allergic risk. Not necessarily what you get through our gene testing. We are cancer doctors, so whatever we do is very much related to that. It's either related to cancer risk or your tolerance to certain treatment. So some profile, because they do say, for a same type of cancer, we might have various options of treatment. So they tend to tell us which one will respond better for this particular tumor for this patient A. So that's what we are focusing on mainly, actually.
Yeah.
Yeah.
Okay. So I guess if I'm looking for the medical aspect of it, better go to Columbia Asia Bukit
Yeah,
Rimau.
I mean, nothing against ctDNA. By all means, explore your chances. But yeah, I mean, I can only speak on what we're doing here. So yeah.
Yeah. Okay. Got it. Because with the marketing, it's so cool. You want to know where your genes come
That's
from, but
right.
also,
Yeah,
healthy.
that's
Yeah.
that's. I think that's a general thing they do, which is not a bad thing at all.
Mm-hmm.
If you can afford it, you should do it. Actually, yeah.
Okay. Got it. All right. Okay, cool. So we actually have our winners, but before we hear who our winners are, let's find out the correct answers to the Q&A, okay? So, are you guys ready? All right. So, the first question is, Doc, I need your help for this. Cancer cases are slowing down in Malaysia. True or false?
What do you think, Nina? I mean, that's the very first thing I mentioned.
Exactly.
I
That's
hope
why
nobody got wrong for this. Then
Yeah,
I'll be really upset.
exactly. It's rising. I think we said it like about 10 times. So hopefully
Yeah.
you guys
Okay.
got it right. So cancer cases are on the rise. So it is false. All right. Genetic testing can help cure patient of cancer. True or false, Doc?
It's false.
Yeah, cannot. It can help
I hope
people.
nobody said true though. I mean,
Mhm.
I think we spent like what 4 to 5 slides on it.
Yes, indeed.
So
Okay.
it
And the
can
last,
only identify your risk. It can
yes.
help you to detect early. It may help in prevention. It helped to effectively treat. It's not a curing
Cure.
method. It doesn't. Yeah.
It's not a pill, basically.
Yeah.
We wish it
Unfortunately, we
was.
haven't found a cure,
Yeah.
but we are
But
headed
not
there.
yet. But not
Not
yet.
yet. Not yet. Yeah.
Okay, question number three. A PEP test helps in screening for cervical cancer. True or false?
Hmm. That should be easy though.
Yeah, this is the
True.
only true in the slide. So it's false,
Okay.
false, true. All right. So who are our winners? Okay, let's see. Okay, so congratulations. Our winners are C Stars, Angeline Chung, and Pua CL. Congratulations to our winners. Let me repeat that. It's C Stars, Angeline Chung, and Pua CL. Congratulations. What's going to happen is that we're going to be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. on how you're going to get your prizes. Okay, congratulations to our winners. For those who did not luck out, don't worry, we have another Doctors Go Live happening monthly, so stay tuned for the next one. You never know if you're the winner. Again, pay attention to the doctor. All right, so congratulations to our winner. Thank you so much for today. I've definitely learned a lot that genetic testing could be the key, and I think there's going to be more advancement in this area, right, Doc?
That's right, Nina.
Yeah. So thank you so much, Dr. Hema, for your wonderful sharing of knowledge. Let's give her a huge round of applause. All right. Thank you so much. We hope you enjoyed today's episode, and thank you from us here at Doctors Go Live. Till next time. Bye.
Bye bye. Thank you.